Hi, my name is Mark Widgery. I'm a GP and co-founder of MedLink, and I'd like to share with you an overview of our online system. MedLink grew out of a desire to interact digitally with our patients in a way that genuinely helped with our ever-increasing workload, while ensuring practice control and not simply opening the floodgates to new patient demand. We wanted to maintain and improve clinical quality while not introducing new clinical risk. And we felt it was important not to exacerbate any digital divide that exists, but design a system that was accessible to all our patients regardless of their level of digital literacy. And so our solution focuses on online reviews of long-term conditions and non-urgent care, and MedLink is used widely by GPs across the whole of the UK. We'll look first at the patient experience, how you get the links into patients' hands and what they see on their device, and then at how MedLink is managing the practice and the benefits it can bring to your review and recall work. The first step is always access. How do we get the links into our patients' hands? And we really didn't want to reinvent the wheel with MedLink. All practices have patient communication tools that they're using all the time to invite patients, most commonly text messages and letters. MedLinks can be added very easily to your invite templates and QR codes to your letters to allow patients to access the reviews on smartphone, on tablet, or on their computers. You can add links to emails if you use that method to communicate with patients, and you can also make them links available via your practice website to allow access to all of your patients through that method. The online reviews themselves, we offer a wide range of reviews covering all of the respiratory and cardiovascular long-term conditions, as well as multiple mental health reviews, medication reviews, for example for HRT and pill checks, as well as a multi-morbidity review which allows patients in a one-stop shop approach to deal with multiple conditions in one go. We have some administrative reviews as well, such as updating contact details and new patient registration. And if you'd like to see the content in the MedLinks, our demo versions of all of our reviews are available on our website. What you're going to see now is a brief overview of the patient experience, showing you what it's like on a patient's smartphone. Here a text message arrives, and within the text message indicating to the patient that their review is due is a link which has been added on the practice side and has been turned into a hyperlink with the blue and the underline automatically by the smartphone itself. And the patient simply taps on that link and it loads directly into the review. There's no preparation required. It works out of the box for all smartphones. As you can see at the top there as well, it's possible to configure to customize the review itself with a banner of your practice name as well as practice logo. There's an introductory section which you can configure, and then if you choose to, you can actually upload a welcome video.
Hi there, it's Dr. Widgery, one of the GPs from MedLink Medical Centre. Welcome to our online system.
All of this reassures the patient that what you've sent them is genuine and that the answers they're going to give you are going directly back to the practice. Then the patient has to simply complete their name and in the full version their date of birth. There is no download, there's no registration, there's no login required. It's a very easily accessible system for the patients. They enter their details, and once they've completed that, they're then into a structured clinical history. The example you're seeing here is of asthma, and here are the asthma control test questions. These are all text, but we do, where relevant, add in images and video to make it a more engaging experience, as here where the patient selects the type of preventer inhaler that they're using, and in this particular example, the type of spacer they then use with that inhaler.
Hello. A variety of inhaler devices are available to treat lung conditions. This video will show...
By incorporating inhaler technique videos directly within the review, patients are able to reinforce and learn their inhaler technique, and also to indicate to you as the practice how they feel about their inhaler technique and whether they want any input for that. We also provide targeted patient information. For example, current smokers are provided with some brief smoking cessation advice within the review itself, and as you'll see in a minute, they then have links to further information. At the end of the review, if relevant, there is a free text section for patients to indicate any concerns or questions they have, and these are always character limited. And then finally, a patient is provided with some ways of indicating how they feel about their asthma control and how they'd like to follow things up. We're never guaranteeing that a remote review is possible, and it may not be clinically appropriate, but we're asking patients to indicate their preference. And then finally at the end, we allow you to customize the signposting. For example, here, patient clicks on the link for smoking cessation, and they're taken through to our local Oxfordshire smoking cessation advice. And you can put in your own customized links for your own local services to make the system really tailored for your own patients. From the point of view of patient engagement, when we first started this process, we assumed that this would largely be a young person's game, that we'd really struggle to engage our older patients. Our experience has been quite the opposite, actually. The average patient age for a MedLink interaction is around just under the age of 60, and we've seen high levels of engagement from our patients even in their 80s and 90s. The only requirement is that the patient has access to a smartphone, a tablet or a computer, and has the link in their hands to be able to access a very straightforward online review without needing any preparation or digital knowledge whatsoever. So what happens from a practice benefit point of view? How does this look within the practice? And we've really broken this down into three main areas: capacity management, practice control, and also a look at quality. In terms of managing capacity, the process from the patient point of view then generates a summary document of the patient responses. And you can see the asthma example here with the patient details. And we'll zoom in a little bit and just look here at the asthma control test. You can see the patient answers with a calculated ACT score and how to interpret that, as well as the sliding scale there, which you can see, which highlights then the areas of potential concern from the patient's point of view if there is poor control. Within the rest of the review, you have a calculated BMI, as well as patient smoking status, and the appropriate both SNOMED and READ codes, which are presented on the summary document as it comes in. For example, you can see in the triggers question, it's a free text question, and that's in a slightly different font to make it clear exactly what format the patient responses come in. And then the patient request, or how the patient feels about their control, is shown on the document as well. And so that document comes into your existing practice workflow. The key here, again, is that we're not reinventing the wheel. Nobody wants a new inbox, a new system change within the practice. And so we've tried to make the process as straightforward as possible to implement at the practice level. It comes into your existing document workflow, and then once it's in your document workflow, those codes then need to be added into the record. MedLink is compatible with all the major clinical systems, and we provide downloadable data entry templates for EMIS Web, PCS, and Vision. For System 1 practices, we provide downloadable scanning rules, which you can then incorporate into your System 1 to automate code entry. Once the codes are entered, the documents are then workflowed through to the most appropriate clinician, and you as a practice decide exactly how those documents are sent through and who receives them. And what we typically find with the reviews, it varies by both the review and by practice, but for the asthma data that we have, roughly 85 to 90% of patients who complete the online review say that they would like that review to be completed remotely rather than requesting any follow-up. Of those 85-90%, we normally find around 3/4 of those patients are deemed clinically appropriate. That's on the basis of the responses that are assessed by the clinician, as well as a look at the clinical record to make sure that if the patient says that control is good, that that's consistent with the clinical record itself. And so overall what we see is that around 2/3 of asthma reviews can be dealt with remotely. And this is one of the real powers of MedLink, because that remote review takes less than 5 minutes of clinical time. That's a look at the document that's come in via the workflow, as well as a review of the clinical record itself. That really helps you to manage a large volume of your review work very efficiently and to create real clinical capacity within the practice. And even where follow-up is needed, either because it's been requested or it's been deemed necessary by a clinical review, it's a very targeted consultation. The questions have all been asked, the responses are already in the record, and so the follow-up can be very targeted and very efficient. As well as releasing clinical capacity within the practice, we really wanted to maintain the control the practice holds over the review process. The vast majority of MedLinks are completed in response to an invitation, and so as a practice you use your existing communication tools to decide, and you decide who you invite, when you invite them, exactly how you do that. There's no promised response time. All of the MedLink reviews are part of routine clinical care, and so the workload that does come into the practice is extremely flexible, task-based work, both for administrative staff and for clinicians. System change when you implement MedLink is minimal, because not only using your existing communication tools, but your existing workflow is the method of receiving those documents and managing them within the practice. And we also allow practice customization of the review content. You saw some of that earlier with the practice logo and banner, as well as the introductory video being added. And within the body and the content of the reviews, you can also make changes. For example, here for practices where it's relevant, you can activate the enhanced service for the NHS digital weight loss service, as well as uploading images of your local weight loss services, which then give patients a taste of what they might be experiencing. You can also add your own fully customizable questions to the MedLinks to really engage your patients and to gather additional data that you as a practice find beneficial. At the end of the reviews, patients can be signposted to various resources, and you can log into the manager and customize those reviews for your own practice population and send your patients as appropriate to things like smoking cessation services, alcohol, weight loss, and psychological therapies. We really wanted to maintain and enhance the clinical quality with the reviews provided by MedLink. And so, for example, here where patients submit blood pressure readings, you're presented with all of the raw data, all of the individual readings they've sent in, plus a calculated average, which takes away a very time-consuming and error-prone manual process from the practice itself. The system will not actually allow potentially malignant hypertensive readings to be sent in. So if a patient does try to enter a reading over 180, over 110, then patients are told that they're unable to do that via MedLink, to contact the practice in another way. We also have an online tool called a MedLink Manager, which is a tool for practice staff which provides a dashboard of your overall practice use of the MedLink system, along with some information about feedback from your patients and the ability to customize the material. We gather feedback from patients at the end of each review, and we've received overwhelmingly positive feedback from patients overall. They really appreciate the flexibility of being able to complete the review in their own time. We've tried to get the right balance of content, enough to be informative for patients, but not so much that we overwhelm them. And just from patients for taking away the pressure of appointments, particularly when there is such huge demand. Feedback from staff has also been very positive. We've seen real appreciation of the ability to manage review work efficiently, gather the data needed for targets such as QOF, and release clinical capacity for those practices that are using MedLink regularly. We add a simple friends and family style question about whether you would recommend this system, and consistently around 90% of patients say yes. We're clearly never going to keep all of our patients happy with any system, but we have seen very high levels of satisfaction overall from patient use. So the million-dollar question, how much does it cost? Well, we wanted to make this system as accessible to our colleagues as possible, and so we offer all new clients a 3-month free trial. You have the full system, we can get you up and running really very quickly. And after that 3-month period, we offer an annual subscription based on practice list size at 10p per patient. And just to put that in context, calculated efficiency savings for the average practice just using asthma alone come out to around 11p per patient just for that one review. We offer discounts for bulk contracts where PCNs sign up or health boards, and we also offer a referral scheme for practices to extend their annual subscription period by referring colleagues on to sign up for MedLink. If we compare the cost to the potential income for practices where QOF or enhanced services are relevant, there's a very significant both potential income for those practices as well as for all practices. The savings with released clinical capacity depends on the level of usage, but for average practices of at least a factor of 4 and going up very significantly with higher using practices. So thank you very much for your time. Very much appreciate your interest in MedLink. Please see our website there, medlinksolutions.co.uk, for full details of all of our reviews, and get in touch, info@medlinksolutions.co.uk, if you'd like to know more. Thank you very much.